Hello, everyone, and welcome back. I'm Matt, your live streaming host, and with us, as always, is Dr. Thomas Payne. Dr. Payne, how are you doing this week?
Good, good, thanks. How are you?
X. Oh, we're doing good. Just it's a new year, new goals, and we've been having a lot of questions on social media about breast implant revisions. And Dr. Payne, I know we've talked about this before, but uh, maybe you can share us how you treat cases in those manners and what your recommendations are.
Yeah, with breast surgery revisions or breast implant revisions, it's it's not uncommon because one of the things that a couple of things to keep in mind is like with breast implants, they're not like forever, so they're not lifetime, but they can last a long time when they're properly placed in the right kind of procedure done with the right kind of patient anatomy. The other thing we see is that sometimes breast surgery is being done by people that aren't really primarily trained for it. So it's an area where there's a little more I would like to say out of specialty adventuring by other doctors. And in those cases, you'll see revision um, procedures that maybe might have been avoided if they had been done, kind of the right plan from the start. So those are kind of the two things that happen. So it's regular, time goes on and the body changes in comparison to the implant versus something that wasn't done ideally. Hard to say because I don't like to criticize directly because I don't necessarily know everything that happened during that first procedure. But sometimes I can get, if somebody has a picture, here's what I looked like before, or here's what I was looking for, then I can kind of get a sense of what happened. Sometimes an implant is placed that's too big for somebody. An implant could be placed that's too small for what they needed. The person might have needed a lift with an implant, and maybe it was not done, or a lift was done, um, when it wasn't really needed, and maybe there's some extra scarring or something like that. So each case will provide its own challenges, and it depends on what someone is looking for. So with implants, just speaking generically about them, they are. We say they're not lifetime devices, but that doesn't mean they have to be removed at any set time. What I'll tell people is if the implant is fine and you're happy with it and there's no symptoms, there is no time where, oh, well, it's next year I have to have the implants replaced or something. That's not true. I've seen implants placed that have been in place for more than 20 years with no problems. And sometimes people will come in and want a lift because they might have gained or lost weight or the tissue has drooped down over the implants. Now, in most cases, if somebody comes in for a breast lift and they have existing implants and the implants are there more than about 5 or so years, I'll say while you're there, you might want to change them to a fresh pair. 5 years might be a little questionable, but certainly if it's 10 or more, it just seems to make sense to restart the clock on a new set of implants. But there have been people that have not wanted to do that, and I have done the lift alone at their request, and they've been okay with it, no problems. So that's why I say, we'll customize the plan to what you're looking for as long as it's, as long as it's reasonable. So, um, in those cases with revisions, now when there's a shape problem, so somebody has, there's bottoming out or there's drooping over the implants, um, those usually happen for a couple of reasons. Like, for example, the drooping over the implants is usually if somebody needed a lift or too big an implant was placed at the time of a lift. And that's the good problem that can happen is that the tissue just sagged down over the implant. If they put a big implant in and try to do a lift, sometimes people get worse problems where things can actually separate. You can have exposure of the implants, things like that. So those are like the worst, issues with it. But if somebody has drooping over the implants, a lot of times what I can do is just do the proper lift on top of them. Um, and if they're happy with the shape with the size that they have, usually leave the implants by themselves. And you don't have to change them out. If they feel they're too big and then they're drooping over, sometimes we'll change to a smaller implant and then do a lift. And then you get a nice, good shape that should last the person a long time. Oftentimes, if something was done, there may already be lift scars that are there, and I usually will use the same ones. They're actually new scars, but they might be slightly longer, but it's not a big difference from what they started with. Now, if somebody had an implant by itself with no lift when they needed one, now they're going to have a little more advanced scarring on the breast, but with proper scar care, that's okay. And they usually do fine. And again, the positive trade off is getting a much better shape, much better breast shape. And given the disadvantage of the scars, that usually is a small disadvantage compared to the big advantage of getting, a better shape that they're happy with that should last them a long time. So that's one thing that we will see. Now, other times people may actually want the implant not necessarily revised, but they may want it removed. They may just be tired of it, or it may be too heavy for them. Sometimes when people are younger, they get a real big breast implant. Then they get a little older and they say, you know what, this is 500, 600 cc's and it's kind of heavy and I don't really like it. So now in those cases, the removal can be done with a lift almost all the time. Sometimes people can actually do a lift and some fat transfer is possible depending on what their anatomic situation is. So I'll offer all of those things, and we can select the techniques as needed based on what we have going on and then what the goals are, for the patient. Sometimes people want the implants out because they feel that they are causing them some kind of health problems. And what I like to do in those cases is we separate out what's going on and find out, is there a new diagnosis of some medical problem? If there is, that has to be primarily dealt with first. So if somebody gets, you know, lupus or sarcoid or something like that. And again, the data on linking these to implants is not all in. And sometimes there's no diagnosis at all. They just don't feel right. And they say, look, we've done everything. My doctor's tried different things and I want the implants out. That's perfectly okay. And we offer that procedure as well. We will remove the implants. If needed, we can remove the capsules. Sometimes people want the capsules removed. Even it may not strictly be necessary, but they may want that done, and that can be done. And then with the remaining breast tissue, we will, shape it and then do a lift so that we have the best looking breast going forward. Rarely somebody will just want the implants out and they don't want to get involved in lifts and things like that. And that's perfectly okay too. That can be done. Depending on how much tissue is there and what the breast volume was and how long the implant's been in place, people will get different kinds of results afterwards. And I'll try to, um, tell people what to expect so that there's no surprises should they just want the implants removed on their own. People with small implants, thick tissue, and not a lot of drooping usually do fine with that. If the tissue is very thin, the implants have been there a long time, and they're very large, if somebody gets the implants just removed, they may be more disappointed because things tend to be more empty and loose afterwards. And again, sometimes people are fine with that and they just want the simplest procedure. That is okay. But as long as they know what to expect, that's fine. So those are all very reasonable options into how things can be handled. Um, with implant secondary breast surgeries, so to speak. And again, we're seeing a little bit more of that because in recent years, sometimes these implants are not, or breast surgery is not being done necessarily ideally the first time, depending on who is doing it. So that's just the way things are. So we try to offer the services to try to help people um, from wherever they're coming from, with what's going on for them.
Well, thank you, Dr. Payne. Appreciate your time as always. And if you have a question for the doctor, please let us know in the comments below. Don't forget to subscribe, and we'll have all the links below for you to find Dr. Payne. And we appreciate your time, and we'll see you.